Over the past few weeks, we've seen COVID-19 spread around the globe. Here in Canada, 93 cases have been reported, and on Monday, one person died. Before we go any further, I want to extend my sincere condolences to their family and friends. Our thoughts are with them as they navigate through this difficult time. Depuis le début, nous adoptons une approche gouvernementale pour freiner la propagation de la COVID-19 et assurer la sécurité des Canadiens. Nous travaillons de très près avec nos homologues municipaux, provinciaux et territoriaux pour atténuer les risques à la population. Les membres du groupe d'intervention en cas d'incident se réunissent régulièrement pour faire le point sur la situation.
Have an update on the situation. The Minister Aidu, Dr. Tam, are keeping citizens in progress. The ministers, Maine, Morneau, are also following closely the propagation of the virus. And the Minister Champagne is working with our international colleagues for an international surveillance and to contain.
Uptick in the total number of cases around the globe, we took additional steps. Last week, we announced a special committee chaired by Deputy Prime Minister Freeland to manage the federal response to the outbreak. We've also put in place screening measures at airports. We've increased testing at the National Microbiology Laboratory. We've invested in research. We've bolstered support for health services in Indigenous communities. But the reality is that the number of people affected by the virus around the globe keeps climbing. Canada has been fortunate so far. We have not seen a drastic spike in the number of cases reported, but I know that people across the country are worried. Worried about their health, worried about their aging parents, worried about the kind of impact this virus could have on their job, on their business. Since day one, our government has been following the situation very closely. We have a responsibility to make sure Canada is ready for all scenarios, and we take that responsibility extremely seriously. That's why today we're announcing a comprehensive package to address the impacts of COVID-19 on our country and to keep Canadians safe. Our government will be creating a $1 billion COVID-19 response fund, which will provide money to the provinces and territories to deal with preparation and mitigation for the virus. I want all premiers and all Canadians to know our government is here for you. We will make sure you have everything you need. Notre gouvernement créera un fonds de lutte contre la COVID-19 d'$1 milliard
COVID response fund of $1 billion that will provide financing for provinces so that they can prepare for all eventualities. To all the prime ministers of the provinces and to all Canadians, we're saying our government is there for you. We will make it so that you have all you need.
The fund will provide $200 million to support the ongoing federal response to the virus, including more money for things like surgical masks and face shields, increased capacity for services to Indigenous people and other federal healthcare responsibilities, and for continued public education efforts to Canadians. It will also invest $275 million in additional funding for research and medical countermeasures, including vaccine development and support for clinical trials. On the economic front, our government understands the disruptive impact the virus is having on businesses and workers. That's why we will waive the mandatory one-week waiting period for employment insurance to kick in. We're also introducing, among other things, special measures under the work sharing program to help employers who fall on hard times due to COVID-19. Let me be clear. No one should have to worry about their job if they have to be quarantined. No employer should feel like they have to lay off a worker because of the virus. We can support you, and we will. Today's announcement is significant, but we are already preparing to do more if need be. Should businesses face a cash crunch in the short term, they can easily access credit to bridge to better times. We will work with our financing crown corporations through the Business Credit Availability Program to protect jobs and to be there for businesses. As we saw over the past few days, the outbreak is having an impact on the global economy. It's affecting supply chains, commodity prices, our oil and gas sector, tourism, and more. I know this is adding to people's anxieties. With a strong balance sheet and a resilient economy, Canada is well positioned to deal with these challenges. Canadians can count on us to provide them with the right kind of support as the situation progresses. En ce moment, les pays dont les systèmes de santé sont plus fragiles,
countries with more fragile health systems are at a greater risk of seeing the virus spread. That's why our government will also be giving $50 million to help countries that are particularly vulnerable. To fight COVID-19, Canada is taking a global approach. First of all, we're making additional investments to ensure that our healthcare systems and our healthcare workers are ready for anything. We are also working with our international partners to ensure that they have the resources they need to stop the virus from spreading locally and around the world.
I know that people are worried about what they're seeing on the nightly news and what it means for their community. We get it, and we're on it. We're working with our international partners to contain the virus. We're applying the lessons we learned during the SARS outbreak. We're making sure our healthcare systems are resilient. We are pulling out all the stops to make sure Canadians stay safe, healthy, and supported. Canada is among the best prepared countries in the world to respond to the situation we're facing. We will get through what comes next together. Encore une fois, merci d'être des nôtres.
Once again, thank you for being here this morning, and I'd now be pleased to take your questions.
Comme toujours, une question.
So as always, one question and one follow-up. There are microphones being passed around, and we have 25 minutes, by the way, and a lot of names on the list, so let's try and be punctual. We'll start with Kevin Gallagher, CTV.
Émilie Bergeron.
And then Émilie Bergeron.
Good morning. Thanks for taking our questions. So first, last week, of course, we had the $27 million for research, and now it seems that that number has grown by a large margin to $275 million. So perhaps explain why this new investment is needed and what it will be going towards.
We recognize that this challenge is evolving, and it's a global challenge, and Canadian science and Canadian research are among the best in the world. That's why we're ensuring that the investments we're making in our science and research are going to respond to this challenge. But for more details, I'm happy to turn it over to Dr. Tam or Patty for Mr. Haidu. On where the research is going.
Thank you. We do call each other by our first names occasionally. So listen, as you know, we announced last week almost $30 million for research. But I will say that we had a volume of calls, or volume of responses from researchers across the country that were also excellent proposals. Amplifying our ability to fund those proposals at this time allows us to much more quickly generate the research that we need to understand, as the Prime Minister has indicated, how we can better contain the illness, how we can actually develop a vaccine that will be effective, and what kinds of treatments are effective with this particular disease. It's obviously a Canadian response in terms of research, but it contributes to the global community of researchers that are working so quickly to try and figure out how we manage this particular virus. Thank you.
And as far as the now, I guess, no waiting time for EI. So how will that program roll out? I mean, will there have to be a diagnosis of COVID-19 or suspected case? I guess I'm really asking, how can you avoid people abusing this type of change to a very important government program?
We have confidence in Canadians. We know that what is extremely important right now is every Canadian does their part to arrest the spread of this virus, to slow the infection curve that we're seeing elsewhere around the world. We know that by keeping a slower pace for the spread of the virus, we will avoid overburdening our healthcare systems and prevent more people from getting the illness. So we need to make sure that everyone is given the tools they need, whether it's figuring out how to stay home from work and work from home, working out with your boss on avoiding rush hour congestion times in public transit, whether it's making smart decisions around shaking fewer hands, washing your hands more often with soap and water, coughing to your elbow. These are things that will actually help Canada and the world fight the virus.
La question va plutôt à Guillaume Saint-Pierre du Journal de Québec.
So Guillaume Saint-Pierre from the Journal de Québec. Good morning. I wanted to know, in terms of the impact on the budget, are we still expecting the budget in March? Have there been any changes? And are you ready to go deeper in, or run a larger deficit as a consequence? Certainly, this is having an impact on how we're designing the budget. I can assure you that the decisions that we've made as a government over the last 5 years have left us some good room to maneuver to be able to respond to crises like this one. We will be there to invest, to help businesses, to help the Canadian economy, to help Canadian workers who are facing difficult times because of this virus. Of course, we are closely monitoring everything that's happening economically and also both domestically and internationally. Personally, have you and your family changed your habits, your behaviors at all? Absolutely, and I think everyone should adapt their behavior by washing their hands more often with soap, by coughing into their elbows, by avoiding handshakes as much as possible. So we can all make everyday choices in the workplace or at home that will help mitigate the spread of this virus. And I think it's important that people know that they can keep their families and communities safe by following those recommendations.
David, ensuite Joël Denis, Bellavance de la Presse.
Hi, Prime Minister. We've seen some projections from people doing modeling on the possible or probable rate of infection in the country, anywhere from 35 to 70%, depending on the range of public health mitigation measures. I'm sure the federal government has been running its own modeling. At this point, what is your sense of the most probable rate of infection in Canada? What should Canadians be prepared to deal with here?
I will turn it over to Dr. Tan and the Health Minister for more specific answers on that. But I can tell you that there are a range of scenarios that we are facing, and the largest factor is actually Canadians' own behavior. We can, by making smart choices as citizens, to follow the instructions of Health Canada, to wash your hands more often, to cough into the crook of your elbow, to stay home and self-isolate if you're beginning to get symptoms of a coronavirus. We can slow down the spread of infection in Canada, and that will prevent from overburdening our healthcare system and allow this disease to be managed more effectively in a way that will have a lesser impact on Canadians' health and on the health of our economy as well. But I will turn to the experts. Dr. Tam, for a perspective on this.
Yes, thank you for the question. It is important to prepare for a range of different scenarios, but of course it's sensible to prepare for something worse than prepare for something that's mild. Right now, in Canada, throughout the public health system, people are trying to identify every case and their contacts in order to slow the spread of this virus into the country. That's a lot of work, but the work actually does matter. As the Prime Minister has said, you need to sort of prevent this rapid rise in cases that will really impact our health system. And by these social distancing measures and people doing the right things, particularly staying home if you're sick, don't spread it to other people, really does make a difference. Protect those who may get the most severe illness is another message that we want to send out there, because that epidemic curve and the number of people who get seriously ill and go into your health system depends on all of us to protect those who may get more severe illness. So around the country, you're going to see different jurisdictions trying to protect their long-term care facilities or nursing homes in terms of setting up procedures. But it also means in individual families, you may have elderly parents or grandparents, and you may have people with underlying medical conditions. But I also want to say that the majority of cases, if we looked around the world, are actually in working age adults. And so business continuity and work planning using these scenarios are very important. But also to say that, of course, that's why the supports for people to do what local public health asks them to do is just so important. So at least from my perspective, the advantage of being in the Canadian system is that people will be supported to do what public health has asked them to do. But everyone actually can change the dynamic of that curve. So that's such an important message that I don't want people to lose sight of. Individual physicians can't do it. Public health units on their own can't do it. Everyone has to contribute.
So just as a follow-up, based on that, do you have a probable percentage on the rate of infection that you're anticipating? And based on your forecasts, should Canadians anticipate large-scale restrictions on freedom of movement and travel within our borders the way we've seen in other countries?
There are, of course, a range of scenarios that we are accounting for so that we're ready regardless of the eventualities. But at this point, our strongest recommendation is for Canadians to be involved in keeping themselves and their families safe, and that will slow the rate of propagation through our country. That is the strong recommendation we're making now. We've also put forward measures to support workers, to support businesses. We're supporting provinces with increased health transfers to be able to allow them to prepare, even in provinces and territories where there are no cases yet, to prepare their health systems to receive cases. We know there is much that we can do now, and we're doing it. We also need to prepare for eventualities, and that's also what we are doing.
Denis, ensuite ce sera Tanda McCharles.
Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. Is the government considering closing its borders to any countries that have a lot of cases, like China or Italy, for example, to avoid having the virus spread? Well, our decisions are always based on expert recommendations. We chose not to close borders to China early on, and I think that we've seen that we have been able to restrict the spread of the virus in Canada over the last few weeks, because we had the appropriate information and the appropriate measures in place to ensure people could take care of themselves and avoid or reduce the spread. We will continue to make decisions based on how the situation evolves. We're not closing the door to any decisions at this point, but any decision we make will be based on the recommendations of experts and the best scientific data that we have. You talked about you and your family changing your behavior. In the political sphere, do you plan to reduce political meetings, conventions, that sort of thing? And what about international summits like the G7 and the G20? Would they perhaps be held by a teleconference instead of in person? Well, these are things that we are thinking about. I know that the House of Commons is thinking about behaviors that could be changed and considering whether we should take additional steps if the virus were to spread further. We are going to continue to make decisions based on the recommendations of Health Canada. And that's what really needs to be underlined here. It's important that businesses, individuals, conferences, and so on follow the recommendations of health professionals in order to stay safe and in order to keep communities and the country safe. There are choices that we can make, things that we can do every day to slow the spread of the virus, and we should all be open to doing that.
Morning.
Sorry.
Tonda.
It's me? Oh, then it's Louis.
Yeah, it's a mic situation. Makes sense.
Thank you. Good morning. Could you tell us, Prime Minister, what you see as the potential impact in Canada of the spread of the disease in the United States? Since we share a landmass, we have open borders. What is your estimation? What's your perspective on the threat posed to Canada by the U.S. situation?
Yeah. Obviously, our economies between Canada and the U.S. are deeply intertwined. The number of travelers across our border every day are in the many, many, many thousands. And therefore, that is a real potential vector of transmission. But we need to know that there are many, many things being done, both in Canada and the United States, to slow the spread of this virus. We continue to engage extremely regularly with our counterparts in the United States to ensure that we're handling as best we can the spread of this virus. We will continue to monitor, to coordinate, to ensure that what we are doing has as minimal impact both on Canadians' health, but also on the growth of our economy.
Can you be more specific about what you have assessed as the impact currently to date over the last 2 months on the Canadian economy from the virus outbreak, including on the tourism and travel sectors?
Okay. Obviously, there are slowdowns in the tourism sector. The recommendation not to take cruises has had an impact. There are many things. I spoke with the heads of some of our airlines yesterday to hear directly from them on some of the challenges. We've been reaching out to businesses and leaders across the country to get a better a better idea of the impacts and the potential impacts on our economy. The finance minister has, of course, been deeply engaged in that in the preparation for the budget. So I'll turn it over to you, Bill, now to fill in on that question.
Well, I think it's an important question that we've been very focused on. I guess I'd let you know that we're in daily contact with all of our banks. Our banking system is strong. They're not seeing as yet any challenges around credit. But as the Prime Minister mentioned, we are preparing business credit availability, and that's an important measure that we used previously. It's expandable, so we're prepared for the eventuality. We're looking to make sure, first and foremost, that we think about health, which will have an impact on businesses as well. If we can mitigate the challenge over a period of time, that will be an important mitigation factor for businesses and for our broader economy. But we stand prepared with multiple measures in order to support businesses and to support people should the challenge be greater than it is today, which of course we expect in certain sectors.
Merci. Louis, et ensuite Paul Vieira du Wall Street Journal.
Monsieur Trudeau,
Mr. Trudeau, will you be suspending the arrival of cruise ships in Canada given the high risk of contamination? And what factors would influence your decision on that? Well, the factors that influence our decision are basically the safety and health of Canadians. We are looking at a number of different steps that we could take. We know that the cruise ship season is starting shortly, and we will have to think about how to protect Canadians who may be taking those cruises, who may work on those cruise ships, but also the communities that may be affected by having those cruise ships at port. So that is something that we are thinking about, and we'll have more to say about it in coming days. Mr. Trudeau, have you yourself been screened for COVID-19? I believe you were at an event last week where there were people who were infected. So have you been screened and have you received any results? No, I haven't had a test. I am following Dr. Tam's recommendations in order to keep myself safe and my family as well. But I would give the microphone to Dr. Tam to talk a little bit more about those recommendations and to talk about that conference and similar conferences where there may have been infected individuals.
Thank you. On travaille vraiment étroitement avec
We are working very closely with provincial and municipal counterparts. This was an international conference, and the Public Health Council is monitoring the health of everyone involved. There may have been some very small symptoms, but for anyone who had symptoms has been told to stay home and to contact their doctor or public health immediately in order to either get screened or follow the appropriate measures. So it is very important that anyone who participates in a conference where someone was infected, that they really monitor their symptoms. That's the most important thing.
Marie Vasselle du Devoir.
Good morning. Japan this week came out with a $15 billion financing package to help companies deal with the coronavirus threat. Britain today introduced a budget with what's a £30 billion fiscal package to protect against coronavirus. Why are we not being so aggressive at the start, given some of the risks that are evident? And are we not at risk at underestimating the damage to the economy, not just from the coronavirus fallout, but also the sharp plunge in crude oil prices this week?
The message we have for Canadians and for Canadian businesses is that we will be there for them. What we've put forward today are significant measures that will both support workers and businesses as they face challenges due to coronavirus's impact on the economy, but also measures that will keep Canadians safe. But as the finance minister has said, and as we will keep saying, we are ready to do more as the situation warrants it. We know that Canada is in a good position so far, both fiscally and with a strong health system that has managed to slow the spread of virus in Canada, but we are always ready to do more. We will be there to support provinces. We'll be there to support businesses. We will be there to support Canadians through this difficult time.
Do you have a follow-up? Bonjour. Je veux poursuivre.
Good morning. I just wanted to follow up on the last question. I understand the House of Commons is thinking about how it's going to react, but you, as the leader of the Liberal Party, are you considering asking your members of Parliament to stop traveling? One of your members of Parliament and one of your ministers are currently in voluntary quarantine. I imagine that you may have had contact with someone who was infected. So are you considering asking people to stop traveling and to have them stay in Ottawa for the next while? Currently, we are following the health professionals' recommendations. That applies to individuals, members of Parliament, and Parliament as a whole. I myself have been modifying my schedule in order to adapt travel plans so that I'm not interfering with any work that's being done on the ground. I know that we all, as individuals and organizations, need to follow those expert recommendations to ensure that Canadians' health is protected. And, of course, to minimize the economic impact as well. But could you, I mean, you said you were modifying your schedule. Are you canceling engagements? And a follow-up question for you or Mr. Morneau. Now, the money that goes to the provinces, is that proportional based on the size of the province, or is it based on need? Is that money being given right away, or are you waiting to assess the needs of the different provinces first? Well, in terms of my schedule, we will keep you updated if we have any things to announce, but there have been some changes to my schedule for the coming week. In terms of funding for the provinces, we have announced $500 million in health transfers to the provinces, and that money will be dispersed according to the normal proportions.
Environ, on va passer à David.
We have about 5 minutes left. We'll take David Aiken from Global News and then Raymond Fillon from TVA.
Good morning, Prime Minister. The premiers arrive at the end of the week, and I know that on the agenda is discussion about fiscal stabilization. We heard Premier Kenney earlier in the week ask for lifting retroactively of the cap on fiscal stabilization. So as you sit down with them, what's the argument against that, or what are the factors from your perspective on lifting that cap?
I'm looking forward to sitting down with the premiers tomorrow to talk about a wide range of issues that affect Canadians right across the country. The coronavirus will, of course, be a prime element of discussion, both in how we're ensuring we're going to keep Canadians safe, how the federal government will be there to support the provinces and their health systems as they tackle this challenge. But we will also talk about the impact on the economy, on workers right across the country. The oil and gas sector is being particularly hard hit right now with the drop in global oil prices. So we will be discussing with Premiers Kenney, Moe, and Ball the impact on our oil-producing provinces and how we can ensure that we are supporting families who are facing difficult times.
And just following up an issue you've touched on, recognizing Dr. Tam has said it's up to us as Canadians to keep ourselves safe, our families safe. As we talk about this flatten the curve hashtag, have you talked about when is the time that there may have to be some mandatory restrictions on the freedoms Canadians take? Is that your job, or is that the provincial health authorities will impose those mandatory restrictions?
Well, it's not about time. It's about the situation and the facts on the ground. We will closely monitor what is needed to be done to keep Canadians safe. We, of course, will focus on voluntary measures, on encouraging Canadians to follow the advice of their health professionals, to look at their own lives and how they can make small changes that will keep them and their families safe alongside keeping their communities safe. We recognize that Canadians have been through health challenges before. We remember well the SARS crisis, and Canadians have demonstrated an ability and a respect for health professionals and an ability to follow their recommendations that have kept us safe in the past and will keep us safe now going into the future. So while we are prepared for a wide range of scenarios, we will focus right now on what needs to be done now and endeavor to make sure that that is enough, that we don't have to take future steps.
Bonjour. Il y a bien des Canadiens.
Good morning. A lot of Canadians are wondering how serious this situation is. How would you qualify the situation? Well, I think that this is a serious situation. I think that Canadians need to be aware of what they can do to help protect their families and the health of their neighbors. We all have a role to play. I think, there is reason for concern if you look at what's happening around the world in Italy, China, Iran, and elsewhere. Certainly, there are concerns on the impact of those citizens and the impact on Canadians and the economy and jobs and so on. But we've been very lucky in Canada because we are in a position where we can protect the health of our own families and our fellow citizens by changing our behavior. If we change our behavior in an appropriate, well-thought-out way, we can keep other Canadians safe, and that's exactly what we're recommending. We recommend that people be aware of the risks, but that those risks can be minimized. Often, there are crises in the world where ordinary citizens don't feel empowered to impact the economy or to impact how that crisis evolves. But here, people can make a difference. Their behaviors will have a direct impact on the health and safety of other Canadians and on the economy as well. So we encourage people to be aware of what they can do, to make the appropriate choices, and to listen to health experts. While we, on our end, work to ensure that both economically and from a health perspective, we have all the resources we need to support people in hard times. Have we laid out any scenarios in Canada about quarantine or wide-scale shutdowns? We have prepared for a wide range of scenarios. That's the responsible thing to do. We need to be ready for any possibility. But I'm confident that we're very far from arriving at that point. The work that our public health experts are doing and that all the different levels of government are doing is currently working to keep Canadians safe. And if Canadians themselves take some simple steps like staying home if they feel sick, coughing into their elbow, washing their hands with soap regularly, avoiding handshakes, well, all of that will help have an impact on the health and safety of all Canadians.
Tout le temps qu'on a, à moins que vous ayez...
I believe that's all the time we have, unless you have time for another question. Thank you very much, everyone.